A Canadian association that represents the medical technology sector is warning how a trade war could mean higher costs right here at home. MedTech Canada says the disruption could be widespread, affecting everything from MRI machines to pacemakers to artificial hip joints. For more on this, we are joined now by Mina Tadros. He's an assistant professor at the University of Toronto's Leslie Dan Faculty of Pharmacy. Mina, thank you so much for making time for us.
Thanks for having me.
So, mercifully, we're not in the midst of a trade war yet, but if these tariffs do come into place in a few days from now, what would that mean for the pharmaceutical industry, for medical medicines that we all need and we rely on every day?
Yeah, I think if we've been very concerned about this. As many people know, supply chains have been a major concern even prior to the pandemic, and then after the pandemic and throughout it, we saw a lot of supply chain disruptions, especially in the drug space, which is what I think a lot about pharmaceutical drugs and over-the-counter drugs. And what a little bit of the concern was that in previous sort of tariff bids or in the previous Trump administration, medical devices and drugs were often exempt and they weren't added to the piece. And so we're a little bit concerned that in this round, they haven't been left off the table. And this sort of leaves on the table an opportunity to increase the price of these drugs. It would mean that we would send ripples throughout the supply chains, and this could have detrimental effects for a lot of different drugs on both sides of the border. Canada does send a lot of drugs to the United States. We have some generic manufacturers right here at home, and vice versa. We receive medications from there. And I think it sets a very dangerous precedent around how we treat medications that are life-saving for many patients around the country.
And in terms of, I want to return to that in just a moment, but also get a broader sense of medical equipment. What would that mean then if there's a trade war?
I think it's really challenging to know what it means. I want to paint a picture. Again, I'll go back to the drug space because that's what I know expressively well. But, most medications are actually not produced in Canada or the US. And the production of a medication, for it to end up on that pharmacy shelf, it probably crosses over 3 or 4 different borders at minimum. The powder that's in the medication will end up going to a place that puts all the ingredients together, bringing ingredients from multiple countries. They will then put it into a vial, and that will be packaged somewhere else, and then the labels are created in a third country and shipped to a fourth. So as countries start to have trade wars and put tariffs, it becomes complicated. In some cases, it might cross into Canada, go back to the US, and then come back to Canada again. So you can imagine, are we just going to add on tariff over tariff? And I think these are the kind of details we don't understand. And in the end of the day, as these prices mount, it's going to get passed on to the healthcare system and consumers. And what I'm really more concerned about is as this happens, it's going to send ripples into a fragile supply chain, which means we can have an increase in the numbers of supply chain and shortages. Now, for listeners, I wouldn't get too worried just yet. One protective thing that does exist is that this is sort of like a slow-moving train in a way. Supply chains are buffered for months of supply, things that are sitting on the shelves, sitting in wholesalers and sitting in places. And so this does mean that regardless of what happens, we do have an opportunity to shift and find solutions. It'll be slow, it won't be instant, but I do think we have an opportunity here, but we should be acting ahead of time if we think that things are going to start affecting our supply chains.
Should Canada, and does Canada have the capacity to make its own medications? Can we do everything internally here?
Yeah, this is a great question. And the answer is bluntly no. And most countries can't. Even the United States, whose economy is, on estimate 10 to 12 times bigger than ours, can't produce themselves out of this. And prior to this administration, we were actually talking about creating North American resiliency, working together, working between countries to ensure our supply chain. 80 to 90% of drugs in some way actually come from China or India. And so as we see the US turn its attention to putting tariffs all over the place, we are a bit concerned this is going to be a ripple around the world and start to affect a lot of different supply chains. So bluntly, no, Canada can't produce all of its drugs. We are blessed with thousands of different treatments, hundreds of different medical devices that can affect and help and improve lives. But with that blessing means we have to rely on different countries. And that's why we often urge people to just leave drugs and medical devices off of these tariff wars. And so we can ensure the safe supply chains are continued throughout the world.
So are you all, everyone from your sector, anyone from your sector, having these conversations with the premiers or with the prime minister or with any of the various organizations that are getting set up to try and negotiate with Washington?
Yeah, we are working to produce numbers so that we can back those up. We do, for years have been studying what the impacts are. We've pinpointed what drugs are critical. Health Canada, currently in Canada, has a list, a draft list of what medications they know are critical and important. So they're developing policies to protect those that will allow more buffer in our space. They're going to be doing the same around the clock. And we are trying to feed numbers into this leadership so they can better understand and bring to the table the idea that these should be left off the table. We're also hoping and working with colleagues across the border to do the same as well, because I think, the US also needs to recognize that there are drugs coming from Canada into the United States, and many of those are critical medications for them as well. And so this isn't a back and forth thing, but I think I would hope we go back to that narrative of working together to try to protect the supply chain in a resilient fashion.
What are you hearing from your American colleagues? Are they also pressuring their senators, their representatives on this?
Yeah, so my colleagues across the border who I work very closely with are having the exact same conversation. Some of them are writing to their senators, calling, working with them as well. We know that there are members of the Senate and leaders throughout the space who are hoping that this gets left off. And I think that there is a understanding that these increased costs in a country that is already pressured by drug costs and has an access problem, this is just going to make the situation worse. We're talking in the billions of dollars of drugs that are probably crossing the border from Canada to the US. And so those costs will be passed on to the insurance companies, the hospitals, and potentially out-of-pocket costs for the patients themselves, who we know are already stretched, especially in the United States.
Okay, Meena Tadros, thank you so much for your time today.
Thank you for having me.